Hi, I'm Dr. Jeff Schels with Advanced Chiropractic, and today I'm going to go over how to do the general neck exercises. So before I go over the specifics, I just wanted to go over some general information about the exercises. The first thing is any exercise plan generally would start with stretching type moves, and then eventually, whenever the person is a little farther along with the stretches, move into more of the strengthening type moves. And that's not only with spinal issues, but really most exercise programs kind of go into that pattern. So we're first going to go over the stretches and go very specific with each one. And then afterwards, we're going to go into the strengthening exercises. So it is super important to know that whenever you're doing any exercise, you always want to do the exercise only in the pain-free range. So for instance, if a person was doing a stretch, they're going to be moving their body in a certain direction as far as they can and try to go a little bit farther than the normal range. And the goal there is to take the muscles and the ligaments and the tendons and stretch them to make them longer to improve the overall motion. However, it's important to know that you don't want to do that if you have any type of sharp pain. So whenever you do an exercise, like for instance, if the exercise is leaning, you want to lean over and go as far as you can until, if you do feel pain, you want to go right up to the pain and then just back off a little bit and hold the stretch only in that pain-free range. And what you'll notice over time, particularly if you're getting your adjustments and doing the in-office rehab, that eventually you'll be able to go all those motions with less pain. So let's start. So with the general neck exercises, you always start with the stretching exercises. And the first stretch is forward bending. So to do this one, you can either do it standing or you can do it seated. But the key is you want to lean your head as far forward as you can. And you should feel a stretch in the back of the neck and lean your head as far as you can. Hold that for 10 seconds. And then relax. And you just relax for 3 seconds and then you repeat it. Hold your head forward and you hold that 10 seconds and relax for 3 seconds. And you do that a total of 5 times. Again, if you have any pain, then you just go as far as you can without pain. The next stretch is rotation. So on this one, you do the same thing, but as far as 10 seconds, relax for 3. But this time you're just going to keep your shoulders straight and turn your head as far as you can and hold that for 10 seconds. And relax. And then again, hold for 10 seconds and then relax for 3. And you do that 5 times on the one side and then you turn and do 5 times on the other side. So 10 seconds and relax 3 and then just do that 5 times on each side. And you can do these either seated or standing. The next one is extension. Now, if you have a history of neck issues, this one can be a little bit challenging, so you have to be very careful. So on this one, you're going to slowly, very slowly lean your head back as far as you can go. And then when you are at maximum extension, hold that for 10 seconds. And then relax for 3. On this one, if you have neck issues, not only can it cause pain, but a person can also get kind of dizzy. So it would be important to do it maybe seated instead of standing with that one if you have problems. So hold 10 seconds back, relax for 3, and do that 5 times. The next one is side bending. Now, you can just do it with your arms down and leaning over. The form that we hand out always has the person with their hand behind their back. And the whole purpose of having the hand behind the back is this arm here holds that shoulder down so you get a better stretch. So on this one here, you'll be upright here. Of course, you can do it seated as well. You'll take your other hand, reach over, and slowly lean over, keeping your head straight, but you're going to try to bring your ear down to your shoulder. You should feel the stretch in the muscles on the opposite side. So you're going to hold that 10 seconds, and then relax. And it's also important to know as you're doing these exercises to breathe through the whole time you're doing the exercises. Relax for 3 seconds, lean over again for 10, and then relax for 3. And you do that 5 times on the one side, and then you switch and go over the other direction, 10 seconds, then relax for 3. And with this one, you always want to go kind of slow into it so you don't have any issues, and do that 5 times. So those are the general stretching exercises. Of course, you want to talk to your chiropractor to make sure that you're okay to do those. So then, depending on your specific condition, it could be a couple weeks later, or it could be a couple months later to start the second phase of the exercises, which are the strengthening exercises. So on the strengthening exercises, again, you're going to do them slowly, breathe through. If you have any discomfort, just do them to the best of your ability in the pain-free range. So the first one is strengthening the musculature in the front of the neck. So on this one, you're going to hold your head and you're going to push against your hand, but your head will actually, it won't move. You're just going to be pushing against your hand. And on this one, you hold the pressure there for 10 seconds, and then you relax. Hold the pressure for 10 seconds, and then relax. So there's really no movement of your head when you do it. You're just pushing against your hand, strengthening the musculature in the front of the neck. Then you're going to flip and do the back. So you hold pressure. Now, if you have problems with shoulder pain or shoulder issues, then this one is probably not something that you would want to do, but talk to your chiropractor about that. But if you don't have any shoulder issues, you're going to just hold the back, push against your hand, hold that for 10 seconds, and then relax. Again, hold for 10 seconds, and relax, and repeat that 5 times. So those two are forward and back. The next one is where it's going to be the same thing, but it's going to be side bending, where you're going to push, you're going to try to be moving your head like this, but your hand is going to stop you from doing it. So you just hold your head still and you push against your hand for 10 seconds, and then relax, push for 10 seconds, and relax, and then that's 5 times on the right side, and then switch, and now you're going to perform that 5 times on the left, holding 10 seconds and relaxing. And the last one is a stretch for the chest. So on this one here, you'll have to find a corner, and then you're just going to put your arms up at an angle like this and lean forward like this. So on that one there, what you're trying to do as you lean forward is stretch your chest. You go for 30 seconds that you're doing the stretching, and then you relax for 10, and then you do it 30 seconds again, relax for 10, and you do a total of 5 sets there, okay? So I hope you found this to be informational and clear up any questions that you might have about that. If you have any specific questions about your exercises, make sure you talk to your doctor about that, and have a great day.